Good morning. Thank you for joining us today for today's webinar, which is Triple P, Helping Parents Be the Parents That They Are Meant to Be. My name is Laura Altman, and I'm the DACE program at Health and Medicine, and we are excited to have people joining us not only from Chicago and Illinois, but all over the country this morning. So Dr. Marjorie Fujara is here to speak this morning, and before I turn over the presentation to her, I just want to provide some background information and also go over a couple housekeeping items. So this webinar is hosted by Health and Medicine Policy Research Group. We work to improve the health of all people in Illinois by promoting health equity, and you can learn more about our work at the link that you see on your slides. The webinar is also hosted by the Illinois ACEs Response Collaborative, which is convened out of Health and Medicine Policy Research Group. And we are a multidisciplinary group that utilizes the science of ACEs and childhood trauma in an effort to create critical transformation to policy and practice aligned with current research. The collaborative illustrates the power of systems-level cooperation to intervene in the transmission of ACEs from one generation to the next, and our many successes have been grounded in a commitment to a collective impact framework, recognizing that no single organization builds community resilience alone. The collaborative fills a critical role by drawing together leaders to think more broadly about ACEs and by coordinating our varied efforts to effectively move the dial. By expanding ACEs research in Illinois, learning interventions in other states and communities, and strengthening the relationships among the groups in our state working to address ACEs, we can develop the policies and interventions we need to reduce ACEs and combat their harmful impact on our health. You can visit Health and Medicine Policy Research Group website for more information, and we have a number of resources, including policy briefs and environmental and scan of trauma-informed programs on our site. I would like to thank the United Way of Metropolitan Chicago for its partnership with the following funders who support our critical work: the Illinois Children's Healthcare Foundation, Crown Family Philanthropies, the Otto S. Sprague Memorial Institute, and the Telegen Community Initiative. Please note that all participants are muted. To submit a question or comment, please type your questions into the question box, which you should see on the right side of your screen in the GoToWebinar panel. You can enter questions at any point during the webinar, and we'll have about 5 or 10 minutes probably at the end of the presentation to answer those questions. Oops, excuse me. After the webinar, you will receive an email with a short evaluation survey, ways to participate in the Illinois ACEs Response Collaborative, and links to the collaborative's website where you can find those resources that I mentioned. And a recording of the webinar and the slides will be made available. So we are delighted to have Dr. Marjorie Fujara joining us today. She will share lessons learned from the recent implementation of an evidence-based parenting intervention, Triple P, as well as the importance of a broad awareness campaign on parenting. Born and raised in Chicago, Dr. Fujara received her medical degree from the University of Illinois at Chicago and completed her pediatrics in Minneapolis at the University of Minnesota. Dr. Fujara is board certified in the new subspecialty of pediatrics. For the past 17 years, she's been part of the Child Protective Services team at John H. Stroger Hospital of Cook County. And in addition to evaluating children for abuse and neglect at the hospital, she sees sexually abused children and adolescents in the medical clinic at the Chicago Children's Advocacy Center. Dr. Fujara also is a member of the Cook County Child Death Review Team. She is passionate about child abuse prevention, parent engagement, and bringing innovative therapies to families for the treatment of toxic stress. In addition to her work as a physician, Dr. Fujara is also a parent to 4 children ranging in age from 7 to 18. So I'm going to turn it over to Dr. Fujara. We're going to start with a brief video. It's only a minute long. You do need to have your audio turned on your computer in order to hear the video. It won't be played over the phone. If you can't hear it, you can at least see, you should be able to see the visuals, and Dr. Fujara will summarize it afterwards. Okay, so I'm going to, let's see, hold on one sec. I'm going to hand over control now of the screen to Dr. Fujara.
Thank you, Laura. Well, good morning, everyone. Thank you for joining us for this webinar. For those of you that are worried that you tuned into the wrong one, I am not here to recruit for the Peace Corps, but I really find that there's a lot of similarities between the Peace Corps and as it's described as the toughest job you'll ever love, and the toughest job I love, which is parenting. And you may not have been able to hear, but one of the last things that the announcer of the PSA said was that Peace Corps volunteers can impact people for generations. And the science of epigenetics presents very strong evidence that the same is true for the environment we create for our children as parents. And I first was struck by the similarities between these two endeavors, that of being part of the Peace Corps and parenting, when we invited Peace Corps alumni to present on their experiences around the world to my daughter's Girl Scout troop 5 years ago. One of the women who presented, let's see, I'm looking for my controller. Oh, here it is. There it is. So one of the women that presented was Madeline. Madeline was deployed to Romania right out of college. And what Madeline talked about was how shocking it was to arrive in this country. And although many similarities existed between Romania and the United States, she found herself to experience a little culture shock because the environment was somewhat strange. And I remembered shortly after my son was born, he was admitted to the hospital with a high bilirubin. And I was in this unique role of not being the pediatrician for this little baby, but being his mother. And how different it was for me to be in this position where I was dependent on other people to help my son get better. Madeline talked about the unique customs around eating in Romania. And as parents of young children, we learn to embrace watching them feed themselves and explore that new skill themselves. And of course, Madeline arrived in Romania without being fluent in Romanian. And so she struggled to understand the people that she met and that she was assigned to help. And for new parents of babies, crying is the only source of communication in the beginning. And that becomes really frustrating and challenging as you try to interpret what your child is trying to tell you. So here Madeline is, right out of college, 22 years old, and she's regarded instantly in Romania as an expert. She assumed an influential leadership role with business people without having really any real life experience in the U.S. herself. And many of us as parents find ourselves in a similar situation where people look to us as experts. And the reality is, we fly by the seat of our pants without ever letting on that we really don't have too much experience in this new role as well. Now, this is my friend Elise, who served in Paraguay, again, right out of college. And here she is with some people in a small town in Paraguay. And she supervised the building of this stone oven. And in the other photo, she's making soap, things she never expected or imagined that she'd be doing as she sat in her college humanities class. And like Elise, I found myself in novel situations I never expected to be. I became my daughter's, who's now 13, her concert buddy, and she introduced me to the world of K-pop, Korean pop music. And there I was, stuck in a sea of lovesick adolescents watching Korea's latest pop sensation known as G-Dragon. Patience was something Madeline spoke about as she had to navigate the unreliable Romanian bus schedules all the time, waiting for one to come. And I was reminded of how much patience we require as parents. Um, as we go through routine milestones of that first haircut, and the erratic and unpredictable behavior of our other children, as we're getting through daily life. Please bear with me while I find my controller again. Thank you. And this is Elise again in Paraguay. And I don't know if you could tell that she helped build this wheelchair. This is a little boy who had cerebral palsy. Before Elise arrived to their town, this mother of this child was carrying him everywhere. But Elise used her ingenuity and creativity to design and build this wheelchair, which was made out of a dining room chair and some bicycle tires. And for those of us, especially that have children with special needs, we may find ourselves also tapping into that creativity to help our children have the experiences that other children have trick or treating. This father helped convert this wheelchair into the stage for him being a superhero, and how empowering that was for that child. The importance of parents to find a team of other parents to share in collaboration and cooperation to do this toughest job really helps us do the heavy lifting as we make our allies. Like in Romania, here's Elise with a team of other women. And this is our team. At the Chicago Children's Advocacy Center, we held one of our first trainings in Triple P on giving seminars to parents. And this is a network of professionals, and I'll talk later on in the webinar more about the details of who we involved in this. But it was very empowering to know that we had this network of people throughout Cook County that were ready and able to go out into the community to really present some very practical strategies to parents. Now, one of the critical differences between parenting and the Peace Corps is that, as Elise told me, the Peace Corps provides you with 3 months of intensive training before you're ever deployed. And unfortunately, for parents, there is no intensive training that were either required or offered early on. So we're often left by ourselves to figure things out. And I find this definition of stress to be extremely useful, not just in my personal life, but in my professional life as I'm assessing and trying to assist families navigate the stresses in their life. As we talk about the demands made by the newborn who won't sleep through the night, or siblings who can't seem to get along, or juggling work life and home life. Financial burdens that every parent experiences, and the daily grind of commuting and how that can wear on us. And if people aren't provided with the resources that they need to meet those demands, then they experience lots of stress. And even though pediatricians are often the go-to people that professionals that parents go to, here's the reality. We're not adequately trained to help meet parenting challenges. Only 4 weeks out of 156 weeks of our pediatric training are specifically devoted to dealing with behavior issues in children. And unfortunately, most of that time is spent pathologizing and diagnosing children, perhaps prescribing medication, without addressing what the parent can do with regard to how they parent to help their children. So as I've done this work for 17 years, what I've encountered are people who tell me that they resort to coercive parenting techniques, corporal punishment, because they have no idea what else to do. And I'm reminded at home that I am no different. As my daughter has said to me, why do I have the feeling that you have no idea what you are doing? And that's because I myself was in this position of um, finding myself parenting without that guidebook, without the assistance of strategies to help me make the job easier. And when our youngest son, Jacob, came into our lives, although we were extremely delighted with his arrival, we found ourselves in the first year of life facing unexpected challenges because Jacob ended up in the hospital repeatedly. And at the age of 7 months, he was diagnosed with a rare developmental disorder that really launched us into this world of raising a child with special needs, with having very few tools on how to help teach a child and discipline a child who had very little language. Jacob had has childhood apraxia of speech, which is a motor planning disorder, which makes it very difficult for him to communicate, to use expressive speech, and makes it really hard for us to know what he understands. In the almost 2 decades of work at Stroger Hospital and the Chicago Advocacy Center, what I've learned is that the children and families that we can predict will be at greatest risk for coercive parenting, resorting to coercive parenting techniques, are parents who have poor self-regulation skills themselves, that have few strategies for dealing with the immense amount of stress that they're under, and therefore they're at a loss on how to help their children who have big feelings of fear and anger and dealing with those in a healthy way, and that these families also lack social connections to help them deal with, again, the demands made on them. So as my work life and my home life collided, and I found my own self struggling, and really was humbled by the fact that here I am, a woman who has an advanced degree. I'm trained in pediatrics, but I found myself feeling very ineffective as a parent myself. I really struggled to find answers. And even though I had all these resources available, I still kept looking for help on how I could be a better parent to my son, Jacob, and offer him the skills that he needed to be successful and as independent as possible. And the CDC posted on their website on violence prevention information about the positive parenting program known as Triple P. I was particularly interested in Triple P because unique to Triple P, it had a special curriculum for parents of children who had special needs, who had children with special needs. I want to go back to that. Their program for those parents is called Stepping Stones. So Triple P was unique in that it offered a suite of materials for parents of typically developing children 0 to 12 called Triple P Standard, Stepping Stones for parents of children with disabilities or special needs, and a curriculum devoted to parents of teenagers, because there are different skills we want our teens to learn. The research evidence behind Triple P, as I did my own research, was pretty robust. There are a number of studies that showed children whose parents go through Triple P have fewer behavioral and emotional problems. There's greater parental confidence in the use of positive parenting, less stress, and I found this to be really a fundamental question that I was looking to answer in my work, because it was clear that children who are at risk for being abused or neglected have parents who are under tremendous amounts of stress. And that parents who went through Triple P interventions had less conflict with their partner. I was also intrigued by the idea that Triple P had been implemented in at least 25 different countries and unique cultures. And after going through a number of Triple P trainings myself, I came to three conclusions. Number one is that Triple P is trauma informed. It really meets the client where they're at and helps them find their own answers to their questions. It provides them with enough information to really come up with their own solutions. So it's very empowering. And when people ask me what it means to be trauma informed, I I compare being trauma informed to Mr. Rogers' Neighborhood. You know, Mr. Rogers was a man way ahead of his time. He understood the importance of equity in a community. So King Friday understood that he could learn from the handyman in the neighborhood. Mr. Rogers introduced many children to children with disabilities for the first time. It was the first time I saw a child in a wheelchair, was watching his show. Mr. Rogers addressed the importance of self-regulation in his special episode, What Do You Do with the Mad That You Feel? He taught people, children, how to deal with their anger in healthy ways. He had a diverse community in the land of make-believe and people that worked together and developed social connections that really could turn to each other for help and really came together as equals to solve their problems. And I found that Triple P offered that as well, as it teaches parents self-regulation of their own emotions, as well as how to help their children when they're struggling to deal with their big emotions. Triple P naturally facilitates social connections. And I'll talk a little bit more about that, what that looks like on the ground. Now, I have to tell you that I have been the beneficiary of Triple P, not just as a provider of it in my work, but as a parent. I've found a number of pearls I've gleaned from the training that I've used in my own home. And I'm going to use just three examples to talk about what that's been like. This is the Triple P strategy pyramid. And one of the things I learned early on as I started bringing home Triple P strategies was that the bottom of the pyramid are our most powerful tools as parents. And I don't think this is something I ever really thought about. And I'm going to go show you a close-up of the bottom here. So Triple P teaches parents how to use descriptive praise, how to give short bursts of attention to our children. 60 to 90 seconds is all that we need to give them at times. How engaging them in interesting activity helps build this relationship with our child. When we have this positive relationship with our child, they're more likely to comply with our instructions on what behavior we want them to live. And the importance of showing affection and talking with our children cannot be underestimated. One of the other techniques I learned about in Triple P was in the teen curriculum about planning ahead for high-risk situations. And unfortunately, I did the teen training after I went to this concert with my daughter. This was a 21 Pilots concert at the United Center, and her father bought her the tickets, and I agreed to go with because I wanted to make sure that she was safe at this concert. And what I didn't know was that a general admission ticket meant we'd be standing in the mosh pit. So there I was with my petite 13-year-old, and at one part of the concert, the crowd rushed forward and I lost sight of my daughter. And for 15 minutes, I was panic-struck, trying to find her in this sea of people. And all I could think about was all the people that were drinking alcohol and smoking pot around her, and I couldn't find her. When I finally found her, I found myself yelling at her and telling her how worried I was. And she started to cry and told me I was ruining her great experience. And what I learned about with Triple P training after this event was that if I had planned ahead, I probably would have saved us both some heartache. So planning ahead would have all it would have required me to do was to get to the concert venue and say, if we get separated, I want us to meet by that staircase over there. And it's really simple, right? It's something, though, in the stress of this experience, I hadn't planned or thought about in advance, but it would have saved us both, again, that negative experience. As parents, we spend a lot of time telling our children what not to do. And if we were to change that and spend our time telling our children what we want them to do, we might end up finding ourselves, one, creating more positive experiences for our children and ourselves as parents. And this is a picture of my son and I playing floor hockey, which we do every night before bed. And what I learned was of our four children, he is the best staller at bedtimes. And I found that to be really frustrating that I would struggle every night to get him to go to bed. And after I went through Stepping Stones training, I learned about this really clever thing you can do, especially with children who have speech and language delays, is to create a visual schedule of what bedtime entails. Putting our pajamas on, brushing our teeth, going potty, read. I would often substitute that with floor hockey for 5 minutes, and then it was lights out. And I found that this simple schedule was all Jacob needed to get into the bedtime routine. And once I implemented the schedule, I no longer struggled with bedtime, and it became a much more pleasant experience. And we can generalize these schedules to other things. So for children who have difficulty with self-regulation, we can talk with them about alternatives to throwing a tantrum. Things that they can do, strategies that can take them well into childhood, adolescence, and adulthood, because we all need different strategies for dealing with times when we're upset. And in order to be successful in school and in the workplace and in our everyday relationships, we need to find strategies that work for us to calm ourselves. And that providing children who have special needs and even children who are typically developing with pictures of reminders of what they can do as an alternative to throwing a tantrum, for example, can be really helpful. So those are the three things that I've probably found to be most helpful to me as a parent. I'm having trouble advancing, sorry. I think I'm frozen here. Laura?
Yep, I just advanced it for you. I can.
Okay. It's frozen on my screen, but okay. Let's go. All right. So, is this just to make sure? Because is there a picture of a rocket?
Right now, we're seeing the delivery of Triple P services. I can.
Oh, there should be a picture of a rocket.
Yep. Okay. I think we're on. Yep, we're on it.
Okay. So again, these three examples I've given you, it's not rocket science. Okay, it's very common sense, and maybe some of you already thought of those things before you got into those situations, but I had not. Because what I find is in the day-to-day work of parenting, again, we're dealing with stress, and so it's hard to think of novel strategies when we're feeling stressed. So when we deliver these in a nice package for parents, we can save them a lot of trouble and really help them use things that are going to make parenting more enjoyable. What I started to think about was that these parenting difficulties aren't unique to the patients that I see. They're not unique to my family. In fact, we could see examples of them everywhere. And this is a picture some of you may recognize. It's inside a Party City. And I was at a Party City in October, and I was struck by a young father with 3 small children. I hope you can appreciate how amazing this store is, especially if you're 5 years old or 4 years old, as his young children appeared to be. And this father appeared very flustered and stressed out, and he yelled at his children to stand in stand in place and not to move. And I was just struck by how difficult that would be for a child to show that restraint. I mean, they're surrounded by all these colorful items and candy and toys. And I thought this parent would really benefit from knowing something about Triple P strategies before going into Party City and being able to tell his children certain ground rules about what they could do and not do, but probably standing in place with their hands at their side was not very realistic. So again, the message being that this is universal and that every parent would benefit from learning some strategies. So next I'm going to talk about the delivery of Triple P services. Triple P has 5 levels, with one being the universal public awareness messaging about the parenting experience being difficult and that everybody needs help from time to time. Level 5 is the most intensive, and that really is designed to help parents who have difficulties with anger management or maybe are struggling with depression. And I'm happy to report that so far in the Chicago area, we've been able to train practitioners in levels 2 through 5. I'm going to talk about level 1 at the end, and I'm going to spend a few minutes talking about levels 2 through 5. So as I mentioned, as we go up in order to level 5, those are the more intensive forms of Triple P. They can be levels 4 and 5 can be administered either as a group or individually, but really focus on more intensive work for parents who may not only have individual challenges themselves, but have children that may have been labeled as having oppositional defiant disorder or attention deficit disorder, so more help with multiple parenting challenges. Level 3 really addresses single issues that parents are struggling with. And these can be done at an office visit, talking about tantruming, disobedience, toileting, any number of single issues that parents are struggling with at a certain time. Level 2 really refers to seminars, and we have been able to train practitioners in all 3 different curriculums. So we've trained practitioners in giving standard seminars. That's for parents of children 0 to 12, stepping stone seminars for parents of children with special needs, and teen seminars. And I have to say that this to me is the most enjoyable Triple P intervention to administer. I've been going out to schools throughout Cook County and presenting seminars in the evening. They're free. I've gotten a lot of support from school principals and superintendents of school districts. And the parents end up having a great time. I spend a lot of time interacting with them, and we share ideas. I've gotten some amazing suggestions from parents in the audience on things that have worked for them with their children. And the other benefit of seminars is that you develop this community, they're meeting parents sometimes for the first time of children at their school that they haven't met before. And they're developing relationships within the seminar and after the seminar, and it's really a really powerful experience. So as we've worked to create a Triple P workforce, we first brought Triple P to Cook County in, I think it was November of 2015. So we're about a year and a half into it. And we've really tried to infuse Triple P into the groundwater throughout Cook County. We've recruited participants from a number of different health systems. So Cook County Health and Hospital System, of course. We've trained providers at Stroger, Provident Hospital, and throughout the ambulatory community health network, which are the community clinics throughout Cook County. We've trained nurse practitioners from Advocate Healthcare. Lurie's Children's Hospital recently went through our primary care training. We've trained social workers and pediatricians from there. We've trained visiting nurses from the Chicago Department of Public Health. We've had several UIC community health workers who have participated, as well as an academic pediatric nurse practitioner who will hopefully be able to promote Triple P in her new position at a academic center in Chicago. We've also trained a number of advocacy center therapists, family therapists, that are working independently throughout Cook County, and our new Parenting ACE social worker. I also want to mention the Partnership for Resilience. Hopefully, some of you are familiar with the amazing work being done by this partnership of educators, healthcare providers, and I want to take a minute to really give them a shout out, because they've been amazingly supportive in our work with Triple P, and especially School District 122 has sent out 2 rock stars to be trained, and that's their picture, the 2 women there giving a seminar in their school district. It's Diana Brown and Jean Sommerfeld, and like I said, they are rock stars. They have delivered seminars at their school. They're also trained in level 4 to deal with parents who have more pervasive struggles with their children. And I would just share a little vignette from a seminar they gave. They had parents come to their seminar, and after the seminar was over, they had to flick the lights off to get them to leave because the parents were busy chatting and exchanging phone numbers. And as I said, one of the other wonderful results of these seminars is the community that's developed, and parents getting to know each other and, go to each other as for help. Okay, so I'm going to finish up by talking about level 1. Level 1 is really targeting, its intent is to target all parents. And so it entails developing a media-based parent information campaign. So I was approached by the Illinois Department of Public Health, who had a grant through the CDC on violence prevention through parenting interventions. And they were referred to us by Triple P America because they are interested in the Triple P campaign and the robust evidence base that it had with regard to child abuse prevention. So together, the 3 of us, Triple P America, the Illinois Department of Public Health, and Cook County Health and Hospital System developed what's called the Stay Positive campaign. And what this did was it promoted Triple P and connected parents through a microsite on the Triple P International website, making them familiar with what Triple P is and helping them find a session in their area, provider in their area. And what we decided to do was take the 5 core principles of Triple P, which really aren't unique to Triple P. I would, in my experience of looking at other parent education curriculums, they're really common ideas on what best practice for parenting entails. So creating a safe, interesting environment. Oops. The second one is creating a positive learning environment. The third is using something called assertive discipline, which again really goes to we are more likely to get a positive response parenting when we tell our children what we want them to do instead of what we don't want them to do. Backing up a few rules, not too many, having realistic expectations about your child. And again, as a parent of a child with special needs, this isn't so easy because sometimes you're trying to figure out what those realistic expectations are. And finally, I think this is universal in every successful parenting intervention, the need to remind parents that they need to take care of themselves, and that's a fundamental. So we developed these posters in both English and Spanish. They went to the Chicago Public Library to push out to all their branches. We've delivered them to schools, community centers, all of our ambulatory community health network clinics, and we'll hopefully be rolling these out to WIC offices throughout Cook County as well. The second phase of our public awareness campaign meant to really encourage parents to seek help. And instead of, again, being judgmental that parents are doing things wrong, we want to elevate this idea that we want to help parents become the parent they were meant to be. And I think every parent can be the parent they were meant to be if they're given the resources that they need to do this. So we had these posters up on 3 different subway lines in Chicago, as well as a number of bus routes in the Illinois Medical District area. You know, reminding parents that everybody needs help from time to time. This led to the development of an initiative called Parenting ACE, which is a Cook County community for families. Now, Parenting ACE has a couple of goals. One is to, again, provide parents with the skills they need. And I would say that even though I'm presenting on Triple P and it's the cornerstone of what we're doing here at the Cook County Health and Hospital System, it's not the be-all and end-all of parenting programs. There's a number of evidence-based parent education programs in Cook County that are available to parents. And again, I think there's a lot of commonalities in all of them, and I would encourage parents to seek out any program that's convenient for them to access. We know that many of our families struggle with other things that make the relating of parenting more challenging because they're dealing with survival issues, whether it's housing, if they're in a violent relationship at home, they live in a dangerous community, there's other things they need, and we need to be able to provide them with what they need. And that's one of the missions of the Parenting ACE is to provide them with the help that they need. One of the fundamental impediments to parents seeking help is shame, that somehow the only people that seek out parent education or parent interventions or however you want to label them are parents who need them because either the court has identified them as requiring them to seek the help or they're somehow defective as parents. And we want to destigmatize seeking help. Because that is something, again, we want the message to be that every parent needs help time to time. And then finally, Parenting ACE seeks to connect communities because, again, we know that there is a lot of expertise in their own community and people need to feel safe seeking that out. And one of the interesting things that we've learned in a focus group that we conducted in the Austin community of Chicago was that the one place that parents universally felt safe at both going to and asking for help was their child's school. And again, I would bring back again the Partnership for Resilience and the potential that these relationships between healthcare providers and schools have is very powerful, because we know that it's something that parents really, again, a place that they feel is almost a sanctuary where they feel safe. And that what we really want to do in the end, at the end of the day, is to provide parents and children with self-regulation skills to make them successful in their relationships, in their work, in their schools, and foster these social connections. Because we know that children and parents that have these things are going to be thriving. And I'll just end with talking about how I think that Triple P helps to reduce parenting stress. I think the practical positive strategies really help bring back this enjoyment that we all should get from parenting. Again, not every day, every minute, but when we have these strategies we can go to and that come to us very easily because they've been packaged up for us and delivered to us, it really makes it more fun. Triple P, again, encourages us to, calm ourselves down as parents before we address stressful situations with our children, and reminding us to help our children learn these self-regulation skills, which really foster resilience. There's good old-fashioned non-virtual social connections and networks we can foster through seminars. And again, this idea of optimism and hope, the idea that I can do it. And I think that's one of the most powerful things we've learned in the short time we've been using Triple P. One of the pediatricians that's gone through several trainings said that one of the mothers she was working with said, "Thank you for helping me fall in love with my child again." And I don't think there's anything that's more powerful than hearing that from a parent that you're helping. And that one of the parents has told a psychologist, "You rocked my world by teaching me that strategy. I never thought of doing that." And she was talking about descriptive praise and how helpful descriptive praise is, because no matter how old we are, right, we all seek to please our parents and make them proud of us. And when we give our child descriptive praise, I really like how you played so nicely with your brother, how we're likely to see those behaviors again, because, again, the bottom of the pyramid, making our parents proud of us is something I think we forget the power in that as parents and how helpful that can be. And again, enjoyment. I think enjoyment is one of the best antidotes for stress, right? When we're enjoying something, things seem manageable. But all those pieces together that I found, again, I can say that from my own experience of using Triple P in my home with my teens and my little guy with special needs, again, it's made me enjoy being a parent more, and it certainly made me more optimistic and hopeful for the future of the skills that I'm imparting in my children. And again, to feel fulfilled, I think parenting is if we go back to the beginning, talking about the Peace Corps, that's one thing the Peace Corps volunteers shared with us, is how fulfilling their jobs were in the Peace Corps. And I don't think in my life anything has been more fulfilling than my role as a parent. Okay.
Great. Well, thank you so much. That was really a powerful presentation, and especially that idea that all parents need help sometimes. There was so much information, so thank you. We have time for just a couple quick questions before we close out. One question is, can you talk a little bit more about how parents can access Triple P?
Yes. Well, we've just recently launched our website, and our website is parentingace.org, and I'm sorry, I should have included this in a slide, but of course I thought of this as I was presenting. So our website, parentingace.org, will promote the locations of seminars. The other thing I would do is encourage people to email us. You can either email me directly. We are happy to bring seminars out to schools, at community centers, any group. We can work it out and present in the evening, and any one of those 3 tracks, either standard triple P for parents of children 0 to 12, stepping stones for parents of children with special needs, and then finally the teen seminars. We can bring those presentations out into the community. So you can email me, or there's also a email address attached to our website that's at parentingace.org. That's a possibility too. And we're going to be updating and the third option is to go directly to Triple P America, and that'll take you to the Cook County site as well.
Great, and we will send out a follow-up email after the presentation so that people have it. And one other question that we're seeing is, are there any future plans for a public awareness?
Yes. Actually, we're about to enter the 3rd phase, and the 3rd phase is going to be referred to as connecting the dots, because I'm sure everybody that's participating in this webinar understands the relationship between experiencing early childhood and how we're parented with negative outcomes, right? With not only negative health outcomes and risk for mental health problems, but community violence. And so what we want to do is really help make that connection clear to the public, that, how we parent and being the best parent we can be, being the parent we are meant to be, really has consequences for everyone. And really, again, the power of looking at it through that public health lens.
Great. Well, I think that might be all that we have time for today. So I just want to say, on behalf of Health and Medicine Policy Research Group and the Illinois ACEs Response Collaborative, a big thank you to Dr. Fujara for taking the time to present this today. And also thank you to all of you for joining us. On the screen, you'll find contact information for Dr. Fujara as well as for myself. The website for the Illinois ACEs Response Collaborative is here, and you can go there for a number of resources, as well as the Health and Medicine's website and our Twitter handle. So we will send an email follow-up, as I mentioned, with an evaluation. So please, we'd really appreciate if you take the time to fill that out so we can learn more about your interests in future webinars. We do have another one scheduled on March 30th, so we will send out information about that soon. And otherwise, thank you so much for your time, and we appreciate your participation.
Thank you.